I'm a stroke survivor, two-time stroke. 2018, I had a stroke, and 2022. By looking at me, you would never know. Why? Because my health care helped me to get those services that I needed to get back to who I am so that I can be the voice for the people.
Right. What is happening is there's going to be $880 billion taken from people's health care, from Staten Islanders health care, from her constituents. That's going to hurt the senior community over in New Lake. It's going to hurt the senior community in Carmel, Richmond. It's going to hurt the constituents on the island and in South Brooklyn.
Okay, I am the president of my tenants association in Staten Island, New York.
Okay.
Stapleton Nurture Houses. I need my health care. I know everybody else, it's very essential. I'm a stroke survivor, two-time stroke. 2018, I had a stroke, and 2022. By looking at me, you would never know. Why? Because my health care helped me to get those services that I needed to get back to who I am so that I can be the voice for the people.
Right.
So I'm here today to say we need our health care. It is very essential, not only to us, but to our children as well.
Absolutely.
My name is Cecilia DeSalle. I'm the Vice President of Stapleton. I need my health care because I'm basically a multiple myeloma winner. I basically beat myeloma and all my coverages that I need. Basically my medication, my children, their school, everybody else. I need my Medicare. Where's Nicole?
I can go too. So my name's Colin. I am a community organizer here on Staten Island. I'm a resident of Great Kills, and I'm here to say stop the cuts because what's happening now, and I know Nicole would talk around it and say like, oh, we're going after fraud, waste, and abuse. The line doesn't work, all right? I just want to put it out there. It does not work. What is happening is there's going to be $880 billion taken from people's health care, from Staten Islanders health care, from her constituents. That's going to hurt the senior community over in New Lake. It's going to hurt the senior community in Carmel, Richmond. It's going to hurt the constituents on the island and in South Brooklyn. So besides that, also going after and making these cuts, they're trying to take funding from special education as well. My mom, she works in the school. It's actually right around the corner from the Stapleton houses. She's a one-to-one parish. She works with kids with autism. Special education funding comes from the federal government. You cut that funding, you are hurting your children with autism. You are hurting their parents. You are burdening families on the island. You are burdening older people. These cuts cannot stand. Those children in development, they are traumatized. They rely on Medicare and Medicaid to get social services, to get therapists, to be able to go to doctors and stuff. And with these Medicare and Medicaid cuts that will happen without action from Nicole, it's a disaster waiting to happen for people on Staten Island and for our constituents.
I'm Soledad here, and I'm a Staten Island business owner. I'm also a 9/11 survivor, and I just recently had surgery for a brain tumor. So obviously I need medical care. And as an employer, and with the line, yeah, and I totally agree that the line of cutting waste and fraud doesn't fly when you have somebody trying to throw himself a military parade for his own birthday and going to Daytona, going to play golf, all of which we're paying for. But all of that aside, as an employer, and I work with a lot of young people, we have internship and mentorship programs, so we work with the students from Staten Island, high school and college students. I don't see how you're making America great again by cutting education, cutting Head Start, cutting science and research funding. That doesn't lead to a nation becoming great. That actually leads to us falling way behind.
Hi, I'm Bianca. I live in Staten Island. I'm a stakeholder in the neighborhood of Stapleton. I recently got hit by a car. Not once, but twice. I was riding my bike, and I was able to get a disability early on. They found something in me called fibromyalgia.
Okay.
I was a professional chef, and the judge looked over my medical history. Had I not had insurance, they wouldn't have found that. And I was told within 2 years I'll be in a wheelchair if I don't stop working, slow down, take care of my health. And the judge appointed this to me and explained to me that in addition to that, I want to be here for my children and not in that condition. So I didn't know anything about the Medicaid for myself. I knew in life. My mom had it for us and stuff, but we were taught growing up. I grew up in 1979. Be somebody, grow up, go out in the world, get a career. That was all I knew until I was hit with the fibromyalgia diagnosis. And then after that, I was just like, okay, they gotta have insurance. They gotta have insurance. And then I got into politics because I was like, well, who makes these decisions and who helps us make these fundings and moving forward, just like future problems that are today, a thing of the past, and more consistent, so that way we can actually rely on them when needed. So I can tell someone like, hey, when I was growing up, I had this. I mean, I have it now, but it's available, it's there. And Malliotakis, the other day we had a meeting and she was a no-show. I remember a lot of like watching her on TV, and there was a lot of promotion for her. And I was just like, when can we actually like talk with her, or she can like address some of these, like just layman's terms, not just all out, propaganda, but just layman's terms, like what is her real agenda in the elected office, right? So yeah, my name is Bianca, and that's my time. Hey.
All right, Bianca, thank you.
My name is Nancy Clark. I represent the home care worker in the health care field. And it is important not to cut it because a lot of our patients going to be suffering. It's bad enough that they rely upon their home health aide to go take care of them. But if that is cut, who will take care of them? I understand the hospital is important and this is important, but the majority of our funding come from the state Medicaid, so we can't afford, because if that happens, I will be out of a job. Now, is Nicole is gonna get me another job or allow me to work? Because once I lose my job and my medical benefit, where am I gonna be? In the street? It's sad. Home care workers, we don't get recognized for what we've done. But yet still, we always get the hard end of the stick. So I'm here fighting for the citizen action for Staten Island, because we all represent different entities, but we all fight for the same thing. So please, ask Nicole to intervene, because a lot of senior citizens, they're going to suffer. It's bad enough they're suffering because they don't have enough to even get their medication.
We have one more speaker as well. We have the lovely Miss Soledad Harris. I will turn it over to you. Just explain a little bit about yourself, what your connection to Staten Island, and how these cuts are going to impact you.
Hey, I apologize for being late. Sorry. There we go. Sorry. I apologize for being a little bit late. My connection to Staten Island and to Representative Malliotakis' district, I actually run a nonprofit media organization. And so we hire interns from Staten Island, from the local community. And, if you run an organization, if you run a business, you want your people to be healthy, right? You want if you run an organization, if you run a business, you want your people to be healthy, you want your people to have health care. And I want to talk for just a second about lies. Because this administration seems to have a problem with the truth. And as I mentioned, I run a nonprofit media organization. So talking about media, the legacy media, corporate media, is lying to you. And we're hearing lie after lie after lie, but no one has the courage. People are bending the knee, afraid of lawsuits, afraid of being bullied. So no one has the courage to call out and call a liar a liar. When you have a press secretary who stands there wearing a gold cross, conveniently forgetting that inconvenient commandment, the one about not bearing false witness against your neighbor, and you're just sitting there telling you lie after lie, sounding like the pink dress woman from the North Korean Kim Jong-un's regime. No, it's time to call out liars. And in regard to healthcare, we've heard we need to make cuts because there's all this fraud. And the fraud is actually committed by providers, by people, ambulance companies, pharmacy companies, medical providers. And the amount of fraud is actually quite small. And just
this morning I actually heard a clip from the Fox Noise, which could very well be the state-run regime propaganda farm. And it was Jesse Waters who had a guest. And they were talking about how people are buying luxury designer handbags with SNAP. I'm sorry, has anybody ever been to a Gucci or Louis Vuitton, Hermes? Hermes does not accept SNAP. It's time to call out the liars. This is a lie. What Nicole Malliotakis has voted to cut is food and health care for the most vulnerable people among us, and 64% of whom are working adults. So, investing in Medicaid and keeping people healthy actually is good for the economy. These are people who work and pay taxes, which is more than I can say for a lot of billionaires and oligarchs trying to run our country. And keeping people healthy keeps people employed, keeps people working, and we need to say hands off our Medicaid.
Hands off our Medicare! Hands off our Medicare! Hands off our Medicaid! Hands off our Medicaid! Hands off our health care! Hands off our health care!
I
said we fired up! Can't take it no more! Fired up! Can't take it no more! Fired up! Can't take it no more! We fired up! Can't take it no more! We fired up! Can't take it no more!
share just a little bit more about her personal Medicaid story. So she's going to do that, and then we are going to close out with speakers with Troy McGee, who will be speaking after, all right? So let's turn the floor over to Soledad again for just a second.
Hey, so I just wanted to tell you why I'm here looking like I'm one of the Pirates of the Caribbean.
You look fine.
I actually had a mass that was behind my right eye. And this was discovered a couple of years ago. And I had to have brain surgery to remove it. And that actually left me with double vision. And since then, I've been going to ongoing therapy. I go to vision therapy, occupational therapy. I had to learn to do basic stuff like pour myself a cup of coffee. So again, back to the lies that were being told that people in the psychic, they think we are playing lounging around on their Barca lounger watching soap operas or something. No, there are actual work requirements in place. They do check up on people who are have Medicaid to make sure you're doing what you need to be doing, including going to all of your medical appointments. And yeah, I mean, I am very grateful that I right now do have coverage, and I am terrified of losing that coverage. I can tell you that the surgery I had, I can't even put a dollar amount on what it would have cost. And I would not be able to be here today doing what I'm doing had it not been for the medical care that I received, and for which I'm very grateful. Thank you.
Soledad, so we're going to kick it over to Troy real quick.
So I know I'm a big guy, but I intend this afternoon to be short, so we can all head out of here. So, that'll work, right? So, I'm a concerned citizen from Staten Island, and I came all the way across the bridge today because this is that important. And I want to make this a little bit personal for people. We all know that person. It might be a parent, it might be an uncle, it might be an aunt, it might be a cousin that is on either Medicaid or Medicare. I want you to think about that person right now. Because what has just happened is Nicole, her vote alone has defunded our health care. She has taken away people's ability to get medical services. We all know that veteran. We all know that child or that adult that has a disability, that their medical needs are based off of Medicaid. And she, in the darkness and the cover of night, decided with a vote of 215 to 214, her vote was the critical vote. And she's gonna sit up there and she won't meet with us. She won't have a town hall. She won't do but she's gonna go on Fox News or on CNN and tell everybody Hell no, we're not touching Medicaid. We're just doing waste, fraud, and abuse. But you know what? She doesn't care. She has health care for life.
And we pay for it.
And we pay for it. You're exactly correct. She has health care for life. So why didn't she say, you know what, when I'm done, when somebody gets me out in 2026, I don't need my health care. She won't do that. She won't put herself in our shoes. You have to understand. You have to understand how all of this is going to impact you. It's going to impact your neighbor, that person that lives next door to you. It's going to impact your dad. It's going to impact your mom. It's going to impact your cousin. This is personal. Don't let anybody tell you it's not. You have to understand. You have to understand the things that Nicole is voting for. She's choosing billionaires over babies. She's choosing corporations over communities. You cannot allow for a person that shows such disregard for her constituents that she won't even meet with them. She's been in office for over 5 years, hasn't held one town hall, hasn't told you what she's thinking, she hasn't told you why she does what she does.
Vote her out! 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 Vote her out!
So I am going to close with this. I am going to close with this message. It's great to be here, but every one of you have got to go and tell your family, tell your friends. This can't be the last moment. She's trying to ride the wave until everyone forgets. Everyone becomes numb and gets tired. Don't let that happen. Don't let her get away with this. In 2026, I don't know who the candidate's going to be, but in 2026, you make sure that your voice is heard. Thank you.
We will not forget! We will not forget! We will not forget! We will not forget! We will not forget!
We will not forget. We will not forget. Who came out today? Thank you to everybody who spoke. I'm going to just keep you for another couple minutes, but thank you again for everything that you did coming out here today, being a part of this fight to protect people's health care. There are a few things that are coming up. There is on Saturday, or is that Sunday? What's June 1st?
Sunday.
Okay, so I'll go with the Saturday first, then I'll do the Sunday, all right? So on Saturday, there is a day of action in New York City at 237 West 48th Street at 11 a.m., and that is a rally for Medicare for All and the New York Health Act, both things that we were just talking about earlier in the program.
And the Medicaid and Medicare cuts.
Yes, and protesting those Medicare and Medicaid cuts. So that's in the city, that's 48th Street on Saturday at 11.
In front of Social Security.
In front of the Social Security office. On Sunday, June 1st at 1 p.m., there will be another rally, another speak out outside of lovely Nicole's office on the Staten Island side of the district. Again, that's 1 p.m. That's going to be headed up by Representative Dan Goldman. He'll be coming from Manhattan and he'll be speaking out there. And so if you're on the island or you want to come out for that, please do. Again, that's Sunday. That's June 1st at 1 p.m. And obviously, if you heard about this, we're going to keep you in loop in the network and let you know about the other things that we have going on. We always have like pretty consistent action, so we understand if you can't make every one of them, try to make at least one of them. Keep coming out to these things, and we'll let you know about them as they're coming up. All right? June 14th is the No Kings thing. All right, so I'm sure you'll hear about that. If you're not on the listserv and you want to be, we have a sign-in sheet going around. If you haven't signed in yet, please do so we can get your contact info and let you know about the things that we're doing in district and throughout the city to fight against these cuts. Just want to reiterate again, we were here today because Nicole Malliotakis was the deciding vote in a 215 to 214 split vote. She was the deciding vote to take food off of your table, to make it harder for you to go to the doctor, to make it harder for you to afford to go to the doctor. If you are on any sort of rental assistance, she has made it harder for you to get that. There are over 40% cuts coming to the Section 8 program. That means that a lot of people are going to be left homeless. They are already, New York City is in the throes of an affordability crisis. There is a shortage of units. There is a shortage of housing. We already have a homelessness crisis. You cut 40% from the Section 8 program, there are going to be thousands of more New Yorkers left homeless. They are also coming after Section 9 funding. Section 9, if you don't know what that is NYCHA, that is public housing, that's publicly owned housing. For years, they have already been going after public housing by trying to do conversions through RAD-PAC, which would keep NYCHA as owning the land, would put the people living in it under the care of private real estate companies. So that is what we're here to do again. I just want to reiterate and say thank you for everybody who showed up, showed out, protect healthcare, health over wealth. Thank you all once again.
Hands up! Healthcare's a human right! Healthcare's a human right! Healthcare's a human right! Healthcare's a human right! Fired up! Can't take it no more! Fired up! Can't take it no more! We fired up! Can't take it no more! We fired up! Can't take it no more! Show me what it looks like! Show me what democracy looks like! This is what democracy looks like! What do we want? Healthcare! When do we want it? Now! And if we don't get it, shut it down!
Let her get away with this. In 2026, I don't know who the candidate's going to be, but in 2026, you make sure that your voice is heard. Thank you.
We will not forget! 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 Stand up, fight back! Stand up, fight back! Stand up, fight back! Stand up, fight back! You got my first one, stand up, fight back! Health over wealth! 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 That is why we're here to fight! Health is a human right! That is why we're here to fight! Health is a human right! That is why we're in this fight! Healthcare! When do we want it? Now!
Loose group that was formed back in 2009 and for its 16 years of existence has been talking with constituents and with congresspeople about the healthcare needs of its constituents. So when our congresspeople are acting properly and are protecting the care of their constituents, we'd be able to come out and say thank you, show appreciation for what they're doing for their constituents. When they are not working for their constituents, we can do what we're here today to do, which is to talk to Nicole and call Nicole out for her misgivings and her mistreatment of thousands of her constituents and millions of Americans across the country. So, with that being said, the reason why we are here specifically is that last week, Nicole Malliotakis was the deciding vote on the big, beautiful budget bill, which is a $4 trillion tax cut for the richest Americans in this country. In order to fund that $4 trillion tax cut, they are cutting spending on essential service programs like Medicare, Medicaid, on SNAP, on housing and urban development funding in the form of Section 8 vouchers and Section 9 funding. They are also letting the emergency housing voucher program run out, which is a voucher program used primarily by people who are recently homeless or are escaping domestic violence situations. There are also cuts to school lunch programs and all sorts of other things.
Shame! 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 Shame!
And So we are out here today because we have been at each and every one of Nicole's offices. We've been to the Staten Island office, we've been to the Brooklyn office, we've been to the DC office, and no show Nicole has dodged us at every opportunity. And so we are here again today in force to tell Miss Nicole that we are not standing for these cuts. She put the lives of thousands of her constituents at risk. She's put the lives of millions of Americans at risk. And so what we are here today to do is share some stories from constituents, people in the district, and also people around the city who will be affected by these cuts. Because even though she is our representative on Staten Island and here in South Brooklyn, the decision that she made to be the one vote, at 215 to 214, it was decided by one vote, and Nicole is that vote. So without further ado, I'm going to pass it over to Ms. Deborah Manning, who is with Indivisible Brooklyn, who's going to share a story about Medicare.
I'm going to be interpreting Christina's testimony. We are with Make the Road Action. Good afternoon. My name is Christina and I am a member of Make the Road Action. I stand before you today as a constituent from District 11 to call on everyone to fight together to protect Medicaid and other essential social services from budget cuts. I am a senior living on Social Security, a fixed income, and relying on both Medicare and Medicaid. If I were to lose my Medicaid coverage, it would be devastating. Medicaid allows me to access the care I need without constantly worrying about how I'm going to pay for it. Without Medicaid, I wouldn't be able to afford primary care and preventative care, the same care that keeps me healthy at this stage of my life. My health can change very quickly and my body needs regular checkups. I visit my doctor every 3 months to monitor my overall health, and without Medicaid, these visits would become unaffordable, especially if I were to get sick. Medicaid allows me to get my medications at low cost, and without Medicaid, I wouldn't be able to pay for them out of pocket. It is shameful that Congresswoman Malliotakis voted to cut Medicaid to offer more tax breaks to the ultra-wealthy. Millions of people like me depend on Medicaid to survive. In her district alone, there are more than 304,000 people enrolled in Medicaid and Child Health Plus. We are not just statistics. We are real people with real health needs. Cutting Medicaid does not just hurt those who participate in the program. It affects everyone. Hospitals and clinics could be forced to reduce services, staff, or hours in response to these federal cuts. That's why I'm here today to say it loud and clear. Healthcare is a human right, and we demand no cuts to Medicaid. Thank you.
Joan Marcato she is working on Staten Island, your pharmacy tech, is that correct? With $11.99. So everybody please turn your attention.
Good afternoon, everyone. My name is Joan Marcato, and I'm a proud pharmacy technician and a member of 1199 SEIU. I stand before you today not just as a healthcare worker, but as someone who sees every single day the real-life consequences of the policies being pushed by people like Congresswoman Nicole Malliotakis. When Malliotakis voted to slash billions from Medicaid, she didn't just vote against a budget line, she voted against a sick grandmother who needs insulin but can't afford it. She voted against a child with asthma whose parents rely on Medicaid to pay for his inhalers. She voted against working people, against caregivers, against essential workers, against the very heart of our community. As a pharmacy tech, I work directly with patients who depend on Medicaid to survive. They come to the counter with worry in their eyes, asking if their medication is covered, if there's a generic version they can afford, or what they should do if their prescription is denied. I've watched seniors break pills in half to make them last longer. I've seen mothers cry because their child's medication is too expensive and without insurance. And now it's about to get worse. This budget would strip health care from nearly 14 million Americans, including 1.5 million New Yorkers. Right here in South Brooklyn and Staten Island, that's 93,200 people in Malliotakis district who depend on Medicaid. That's 89,000 children, 48,000 seniors, and 20,000 individuals with disabilities. who are being told they don't matter. We are here today to say they do matter.
Amen.
This is a code blue for Medicaid. This is a medical emergency, not just for patients, but for our entire healthcare system. Cutting Medicaid means more emergency room visits, more untreated illnesses, more suffering, and more death. It also means fewer resources for frontline workers like myself to do our job safely and more effectively. Congresswoman Malliotakis claims to represent us, but how can you represent a community while serving your back on the most vulnerable among us? We are here to speak truth to power, to demand that she reverse course, to call on her to stand with her constituents, not corporate interests, but billionaires, not party politics. So I say this to Representative Malliotakis: walk a day in my shoes, come to my pharmacy, watch our people choose between food and medicine. Then ask yourself, who are you really fighting for? Because we're fighting for our patients. We're fighting for our neighbors. We're not going anywhere. Peace among you all.
Walk in my shoes. Hey there, Nicole. Walk in my shoes. Hey there, Nicole. Walk in my shoes. Hey there, Nicole. Walk in my shoes.